Hi everyone, it's Dr. Campbell with another surgery coding review. Today we are going to complete the rest of the 30,000 series by first looking at the cardiovascular system and going all the way to the end. I want to give a warning. This session probably will be a little longer than the other CPT sections just by mere nature of what I have to cover on today. So we're going to get started on page 207 in your CPT manual, and the cardiovascular system consists of codes 33010 through 37799. The major categories that you're going to see under the cardiovascular system consist of the heart and pericardium, and then we also have arteries and veins. So let's jump right in and go on over to page 214 under heart and pericardium, specifically pericardium. So here you're going to see at 33010 pericardiocentesis procedure. As you know, that is an incision to remove fluid from around the heart. And these codes are divided based upon initial and subsequent. Immediately after that, you have tube pericardiostomy, as well as a pericardiotomy and creation of a pericardial window. And lastly, pericardectomy, subtotal or complete. And then there's also the resection of a pericardial cyst or tumor. Next up, guys, on the bottom of page 214, 215, and 216, you have the beginning of your pacemaker or implantable defibrillator codes. Now, it's very important that you understand that these two devices have a particular role that they play. A pacemaker is typically inserted for a patient whose natural pacemaker of the heart, the SA node, is no longer functioning properly. In these patients, we see symptoms of bradycardia or syncope, and so the decision is made to insert this device to help pace the heart. An implantable defibrillator is a small device, just like the pacemaker, that's connected to the heart, and it is designed to continuously monitor and regulate the heart to really jump in when the patient has life-threatening electrical problems with the heart. So it actually responds to an irregular heartbeat by corrects a fast rhythm and then promotes a normal heartbeat, or it actually shocks or defibrillates that resets the heart rhythm to prevent sudden cardiac arrest. Now, on page 214, 215, and 216, you see lots of subsection notes. Some areas that I want to highlight today, and I know you're going to read all of them, but a pacemaker system is a lead or leads, also known as electrodes, with a pulse generator. And the pulse generator is also known as a battery. So you got the battery and you got the leads, kind of like in English. When I first learned about a pacemaker, I thought about, I guess what I thought about was, you know how your car battery dies and you have to hook your car up to someone else's car, and they have those wires and they're able to jump your car? That's what these devices remind me of. So as it relates to the documentation for this type of service, you want to look at, was the device inserted? Was it replaced? Was it removed? Was it upgraded? And on page 216, there's a really cool chart that helps you keep track of these types of procedures, but then it's also separated into the codes that are available for the pacemaker versus the implantable defibrillator. One thing I wanted to tell you about these devices is that they can be a single chamber or a dual chamber. With the single chamber, you have a pulse generator and one electrode that is inserted in either the atrium or the ventricle. A dual chamber, you still have a pulse generator, but then you have electrodes that are inserted into both the atrium and ventricle. There are biventricular pacemakers, and so you'll want to just analyze your documentation to see actually what would apply. Guys, lots of reading, lots of definitions for these codes. Again, on the day of a national exam, it's not the first time you want to be reading this information. So please take the time to review not only the subsection notes, but also the parenthetical notes that say things like, do not report this with that. All right, next up, we're going to go over to page 221, where we have electrophysiologic operative procedures. Now, of note, you're going to see electrophysiologic in the medicine section of the CPT manual, but here we have electrophysiologic operative procedures. So, electrophysiology, that is the study of the electrical system of the heart. And so in the medicine section, you're going to see those codes for where they actually study the heart, and specifically the electrical system. In the surgery section, however, what we have are the surgical repair of a defect that is causing an abnormal rhythm. So your guidelines begin on the bottom of page 221. You have some definitions on page 222. Of note, with these particular procedures, you're going to notice that cardiopulmonary bypass is usually required. And that's because the chest is opened to expose the heart to the full view of the surgeon. All right, next up, we're going to go to cardiac valves, which are on page 224. And guys, you have more subsection notes. And again, I cannot overemphasize the fact that you'll want to review these notes prior to taking any national exam. In fact, I recommend that you read these notes while you're learning CPT coding, because that way you don't have to worry about, it's a month before your exam and you're just now reading these notes for the very first time. So for the procedures on the cardiac valve, they are divided based upon the valve that is actually being treated. So first up, we have the aortic valve, which are codes 33361 through 33417. When you go over to page 226, you have your mitral valve codes 33418 through 33430. After that, you have your tricuspid valve procedures. They're on page 227, very small section, codes 33460 through 33468. And then the last family of codes, bottom of page 227, which start off with a bunch of guidelines. Codes for the pulmonary valve are 33470 through 33478. All right, next up, we have our coronary artery bypass grafting procedures, which begin on page 228. Now, of note, there is a code that is utilized with our CABG procedures, which is an add-on code, and it's oftentimes something that folks don't even realize that it's there because it's kind of before the CABG codes. But I want you to take a look at page 228 under endoscopy, where it says add-on code 33508, which says endoscopy surgical, including video-assisted harvest of vein for coronary artery bypass procedure. Keep that code in the back of your mind because I'm going to go back to it shortly. So with coronary artery bypass grafting, The procedure can be done via the vein only, and there's a diagram on page 229 in your code manual. So vein only, which are codes 33510 to 33516. Then we can have artery only. If you turn over to page 230, there are some guidelines for artery only, and then the codes are on 231, which is 33533 through 33536. So vein only, 33510 through 33516, artery only, 33533 through 33536. Now, there are some times where the CABG is done as a combined procedure. If you look on the top of page 230, there's actually a diagram of a combined procedure. Combined means that it is vein and artery. I don't know if you guys know this, but when in a textbook, or any type of diagram where they're trying to show you the arteries and the veins, you'll notice that the veins are represented in blue and the arteries are represented in red. So if you look at the diagrams on page 229, notice the graphs that are listed, that are displayed in the diagram, are blue in nature. So the first diagram and the second diagram are both showing vein graphs. And then when you look on page 230 at the picture at the top, notice that there is a vein graph and an arterial graph, with the arterial graph being in red. So in your operative report, what you're wanting to identify was it a vein only? Was it artery only, or was it a combined procedure? So if it's vein only, 33510 through 33516, artery only, 33533 through 33536. If it is a combined procedure, and this is reflected in the subsection notes, another reason why they are important. If you look on page 229, the second paragraph, the guideline states that to report a combined arteriovenous graft procedure, it is necessary to report two codes, 33517 through 33523, which are actually add-on codes, and 33533 through 33536. Now, quite naturally, the add-on code would be reported second. So when you have a combined procedure, what I want you to notice is that you are not utilizing 33510 to 33516, and that is also reflected in the guidelines. Also reflected in the guidelines is a statement that says, and this is on page 228, and it's on page 229, and it's on, well, I guess that's it. But the statement says procurement of the saphenous vein graft is included in the description of the work for 33510 through 33516 and should not be reported as a separate service or co-surgery. That's on page 228, second paragraph. It is also on page 229, third paragraph. Again, procurement of the saphenous vein is included. Now, let's pause and go back to something that I mentioned to you at the beginning of this slide. Remember I showed you add-on code 33508? Now, notice that states endoscopy, surgical, including video-assisted harvest of a vein. So procurement of the saphenous vein is included in the CABG procedure. However, if it is an endoscopic vein harvest, that is something that you can code separately with add-on code 33508. I want you to notice that all of these codes are divided based upon the number of grafts that were actually utilized in the procedure. Last thing I want to show you regarding this procedure on page 230, if you look at code 33530, which is an add-on code, this is for a reoperation of a coronary artery bypass procedure or valve procedure more than 1 month after the original operation. All right, guys, that's enough of those cabbages. Next up, patent ductus arteriosus, page 234. Here we have codes 33820 through 33824. PDA is a heart problem that occurs soon after birth in some babies. With PDA, abnormal blood flow occurs between two of the major arteries that are actually connected to the heart. Before birth, those two major arteries, the aorta and the pulmonary artery, are connected by a blood vessel called ductus arteriosus. This vessel is actually an essential part of fetal blood circulation. Within a few minutes or up to a few days after birth, this vessel is supposed to close as a part of the normal changes occurring in the baby's circulation. In some babies, however, the ductus arteriosus remains open, also known as patent. This opening allows oxygen-rich blood from the aorta to mix with oxygen-poor blood from the pulmonary artery, and this can actually put a strain on the heart and increase blood pressure in the lung arteries. So that's why this procedure is being performed. All right, next up, guys. And something I should mention with these codes, they are divided by age. You'll notice that some of the procedures list by ligation for the repair, some list by division, and again, they're divided by age. All right, next up, we have thoracic aortic aneurysm. This is page 234, which starts off with some subsection notes. An aneurysm is when an artery wall in the aorta weakens and the wall abnormally expands or bulges as the blood is pumped through. Notice the bulge here. So with these procedures here, this is procedures to correct this problem, and you'll notice that they are divided based upon ascending aorta graft. Notice the cardiopulmonary bypass is a part of the procedure, and then also notice that there is a aortic hemi-arch graft and a transverse arch graft procedure. There are lots of parenthetical notes to pay close attention to. Next up on page 235 and 236, we have the endovascular repair of the, watch this guys, descending aortic or descending thoracic aorta. So remember those codes that we just saw, those were ascending. Here, this is descending. So you already know what an aneurysm is. It's that bulge. And so this repair is a type of endovascular surgery that's used to treat diseases of the aorta that the patient can be experiencing. So the codes here are 33880 through 33891. Next up, we have our heart-lung transplant procedures, 33927, all the way over to 33945. And one of the things that you will continue to see as it relates to transplantation in the CPT, that there are three distinct components of physician work. You have the cadaver donor procedure, the backbench work, and then the allotransplantation. Next up on pages 238 through 241, you have extracorporeal membrane oxygenation, also known as ECMO, and extracorporeal life support services. So these procedures are a procedure that provides cardiac and/or respiratory support to the heart and lungs, which allows them to rest and recover when a patient is sick or injured. So what this procedure does, and what this diagram is actually illustrating, is that special tubes, also known as cannulas, are put into blood vessels that go directly into the patient's heart or bloodstream. And The treating provider is going to select the tubes based on the patient's size, age, weight, as well as the reason why the procedure is needed. These cannulas are going to transfer the blood from the heart using a pump to push the blood through the tubes to the machine, where the blood is going to receive oxygenation and the carbon dioxide is removed. And then next, the blood is actually warmed to body temperature, and the warm blood goes through another cannula back into the patient's body. Again, allowing the patient to rest while they are sick or injured. Next up, something else that's very, very important I should mention. On page 240, there is a really cool table for these procedures, and they are divided into management and then cannula insertion, reposition, and removal procedures. These codes are divided based upon whether it's veno-venous or veno-atria from the management perspective. As it relates to the insertion, reposition, and removal procedures, they are divided based upon the approach, whether it's percutaneous, open, or sternotomy/thoracotomy, as well as the age of the patient. All right, next up, we have our cardiac assist procedures, page 241 to 242, which starts off, guys, you guessed it, with some subsection notes. So this device here is a ventricular assist device, which is actually a mechanical pump that's used to support the heart function and blood flow in a patient that has weakened hearts. This device actually takes blood from the lower chamber of the heart and helps pump it to the body and vital organs, just like a healthy heart would. Our codes are listed again on page 241, 33967. And it ends on the following page of 243, which is code 33993. Next up, we have embolectomy and thrombectomy procedures. Those are on the top of page 243. So a thrombectomy and an embolectomy procedure are actually life-saving procedures that are performed most frequently in emergency situation. The terms embolectomy and thrombectomy are sometimes used interchangeably. However, there are some differences in the two. A thrombus is usually a solid mass stationary clot. An embolus is when part or all of that clot is dislodged and actually starts to travel through the circulatory system. So essentially, an embolus is actually moving, like a moving thrombus. In either case, these clots can pose serious and even fatal risk. So what you'll notice is that we have those codes available on the top of page 243. They are divided based upon whether the procedure is arterial or venous, as well as what artery or vessel is impacted. Okay, next up, bottom of page 243, we have endovascular repair of the abdominal aorta or iliac arteries. As you guys know, I mentioned this already, endovascular repair is actually a preferred treatment for many people that have what we call the AAA or the abdominal aortic aneurysm. And it's really an alternative for a patient whose body is unable to sustain during an open heart surgery. So guys, guidelines begin on page 243, carry on over to 244 and 245. So the codes begin with 34701 and go all the way over to 34832. These codes, guys, have some very distinctive features and are really divided based upon the type of graft that was actually deployed. So for example, if you look at code 34701 and 34703, they both start off by saying endovascular repair of an infrarenal aorta. But when you start to look in the actual code descriptions, there are some terms that then make each of those codes very distinctive. So again, take the time now to explore the different codes and what they have to offer. Next up, we're going to go over to page 252 to our thromboendarterectomy procedures. This is actually an operation to remove a thrombus along the intima and atherus material from an occluded artery. These codes fall in the range of 35301 through 35390. So they are on pages 252 as well as 253. These codes are divided based upon the actual artery that was involved, as well as if you take a look at 35390, there is an add-on code for reoperation more than 1 month after the original procedure. All right, next up, guys, we're going to go on over to page 258. And unfortunately, I cannot cover each and every procedure on each and every page, but hopefully this gives you enough to want more. So on page 258, we have our vascular injection procedures. Now, this is one of those specialties that you gotta love to hate. So with this particular specialty, you see this performed by interventional providers. And even as a coding specialist, you really need to have an advanced knowledge of cardiac anatomy in order to code these procedures. So vascular injection procedures are usually accomplished via vascular access. And vascular access is where the patient's vascular system is actually entered. Now, as it relates to the injection procedure, a catheter is actually placed into the aorta. In your CPT manual, what you're going to notice is that there are selective and non-selective catheter placement. So non-selective catheter placement refers to a catheter that remains in the vessel or has made it into the aorta. Selective catheter placement is when the catheter is placed into a branch off of the aorta or the access vessel. Each of these vessels arising from the aorta or the access vessel represents different vascular family. A vascular family is a vessel that actually arises from the aorta or is off the access vessel and then includes the vessel's branches. Now, in your CPT manual, and this is actually a new chart for this year, and I actually love this chart. Someone like me that is not a fan of this particular specialty, there is an appendix, and let's see what the number is. Appendix L for vascular families. Highly recommend that you take a look at that particular appendix. All right, so the other thing I wanted to mention why the appendix is important is that these codes are also divided based upon the order, and that has to do with the order of the vascular family. And so you'll notice in some of the codes, it'll say first order, second order, third order, etc. All right, next up, we're gonna go over to venipuncture. And venipuncture codes are on page 262. And here you have venipuncture codes that are divided based upon age. They're also divided based upon what vein is actually accessed. So I want you to think about a baby where they will access a vein from the heel. But the code that is most common to a lot of people is 36415, which is collection of venous blood by venipuncture. So yes, when you have your blood drawn, that is the code that is used if it is a venous blood collection. All right, now there are also some codes here for transfusion 36430, push transfusion 36440. All right, next up, we're going to go over to page 266, and we are going to look at central venous access procedures. So central venous access procedures have lots of rules. Number one, to qualify as a central venous access procedure, the catheter or the device must terminate in the subclavian, brachiocephalic, iliac veins, the superior or inferior vena cava, or the right atrium. Yes, all of that. Most coding decisions are based on whether or not the device was actually inserted, repaired, replaced, which can either be partial or complete, or the entire removal of the device. The other thing that you will notice as you start to actually look at the diagrams on page 266 and 267, as well as 268, is that these devices are also divided based upon how they are inserted. So there is a really cool table on page 270, which is the central venous access procedures table. And you will want to know from the documentation if this device was centrally inserted or peripherally inserted, was there a pump or a port, as well as was the catheter tunneled or non-tunneled, as well as what is the age of the patient. So I know it sounds complex, but if you capture for yourself what these codes identify, then you can go in the documentation and make your code decision. All right, next up, page 272, we have hemodialysis access section 36800 through 36861. There's a couple of different codes you're going to see over here, and so I'm going to just talk about a couple of them. So quite naturally, this particular procedure, the access, is for someone who needs dialysis. There are two types of dialysis. There is a hemodialysis and there is peritoneal dialysis. Both of these treatments are able to replace the kidney's function of cleaning the blood of toxins and removing extra fluids from people who have kidney failure. Some of the terminology that you're going to see used over here include an arteriovenous graft and an arteriovenous fistula. Now, an arteriovenous graft, also known as AV, is created by connecting a vein to an artery using a soft plastic tube. After the graft has healed, hemodialysis is performed by placing two needles, one in the arterial side and one into the venous side of the graft. The graft then allows for increased blood flow. Now, a fistula, however, used for hemodialysis is a direct connection of an artery to a vein. Notice that, guys, it's a direct connection of an artery to a vein. Once the fistula is created, it is actually a natural part of the body. This is the preferred type of access because once the fistula actually matures and gets bigger, it's stronger. It provides an access with good blood flow that can last for decades. After the fistula is surgically created, it could take weeks to months before the fistula matures and is able to be used for hemodialysis. All right, next up on the bottom of page 273 and carrying on a couple of pages, guys. Don't turn, don't look, but on 274 and 275, you have a full page of guidelines. Again, guys, better to read them now before you take a national exam. So according to CPT, dialysis circuit refers to both arteriovenous fistula and arteriovenous grafts. Dialysis circuits can actually be placed at several different locations in the forearm, elbow, and upper arm. So the codes themselves, 36901 through 36909, are divided based upon what they actually do for this dialysis circuit procedure. Next up, over on page 277 for transcatheter procedures, here we have what is known as a surgical thrombectomy procedure. So a surgical thrombectomy is a surgery to remove a blood clot from inside an artery or a vein. You will notice on page 277, outside of all of those notes that are there, that we have mechanical thrombectomy, we have transcatheter thrombolytic infusion, and then on page 278, we have arterial mechanical thrombectomy, and then venous mechanical thrombectomy. So when you're selecting these codes, you'll have to identify first what was actually done in order to select the correct code. Next up, endovascular revascularization. This is on page 281, and yes, guys, it starts off with guidelines. So this particular procedure is performed to clear blockages in the arteries and to remove the plaque that is causing decreased blood flow. This procedure actually alleviates the pain and stops the tissue decay or loss associated with lower extremity PAD. This procedure is actually one that is suitable for a non-surgical candidate. It's actually faster than a bypass and results in faster recovery, with most individuals being able to instantly resume all normal activities within a few days. That's not really instantly, but quicker than they would if it was a bypass. So these are codes 37220 through 37235. Lots of things going on here. Most of the codes start off with the word revascularization, but you'll want to identify if the procedure, what vessel it was done on. You'll notice that for most of these codes under approach, it says revascularization, endovascular, open, or percutaneous. So what that lets you know is that all of those different procedures are included under this code. The difference is going to be what artery they were actually working on. Next up, we have vascular embolization procedures, embolization and occlusion, page 286. And of course, it starts off with, you guessed it, guidelines. I don't know if you're seeing a theme, but this entire chapter has guidelines all over the place. And it makes sense, right? Because cardiovascular is a very complex system. So here with your vascular embolization, occlusion procedures, you will notice that they're actually divided based upon either venous or arterial. They're also divided based upon if there was a tumor or other reason for this procedure. Now, I want to point out why these guidelines are important. Some of these codes, guys, can only be reported once for each surgical field. And so you wouldn't know that unless you read the guidelines. So what's the bottom line? Read those guidelines. Next up, we have vein stripping procedures. And now I'm on page 288, codes 37565 through 37785, and I'm looking specifically under ligation. Ligation means to surgically tie a vein through a small incision to prevent pooling of the blood. Ligation can be performed in conjunction with vein stripping or the removal of the vein. So if you take a look at the codes on page 288, you'll notice that several of the codes start off with the word ligation. In fact, if you look at 37565 all the way over to 37660, they all start off with ligation. When you get over to 37700, notice those codes are ligation, division, and stripping. All right, guys, guess what? We are done with cardiovascular, and we are moving on to hemic lymphatic systems. So we're on page 290, and in this particular area, you have procedures on the spleen, your general section, and then lymph nodes and lymphatic channels. All right, so the first procedure we want to look at is a splenectomy. You'll notice under excision, there are 3 splenectomy codes. And then I also want you to notice, and that's 38100. I also want you to notice that there is an option 38120, and this is for a laparoscopic splenectomy. So I think something that you probably are noticing that's really critical with surgery is that you have to not only know the body part, you have to know the surgical approach. All right, next up, under general, which is page 290, here you have your bone marrow or stem cell services procedures. So here you're going to see various procedures that are done to preserve, prepare, and purify bone marrow and stem cells prior to transplantation and reinfusion. There is a note before these codes that lets us know that each code can be used once per day, regardless of the quantity of the bone marrow or stem cell that is actually being manipulated. And so that's what those codes are all about. They are divided into various aspects of the procedure. Next up, bottom of page 291, all the way over to 292, you have your hematopoietic cell transplantation procedures. This is an actual intravenous infusion of hematopoietic stem and progenitor cells designed to reestablish bone marrow and immune function in patients with a variety of acquired malignant disorders who are being treated with high-dose chemotherapy or chemoradiotherapy to treat the disease. These include hematologic malignancies such as Hodgkin's lymphoma, B and T cell lymphoma, and multiple myeloma. So those codes 38240 through 38243 reflect those services. All right, next up, we're going to go over to page 292. We're already there. And we want to take a look at 38500 through 38530. This is under lymph nodes and lymphatic channels. Here we have a biopsy code, and you'll want to note that the biopsy code family has several options. If it was biopsy or excision of a lymph node, notice it said nodes in parentheses, open, superficial. Then we have by needle superficial, open deep cervical nodes with excision of a scalene fat pad, open deep of axillary nodes. So very important to know what's actually being done. All right, then we have lymphadenectomy procedures. So here I'm on page 293, and I want you to notice that we have lymphadenectomy procedures under laparoscopy, which falls under 38570. Then you have your open lymphadenectomy procedures on the right side of 293. Again, moral of the story, gotta know what is actually happening in terms of the approach. All right, guys, last family here, page 295, which is your procedures performed on the mediastinum and the diaphragm only. So here, we have codes 39000 through 39499, and this is for your mediastinum. The first procedure that you see is a mediastinotomy, and that's a surgical opening into the mediastinum. A mediastinotomy actually gives direct access to the aortopulmonary window lymph nodes, which are inaccessible via a mediastinoscopy. Speaking of, we have mediastinoscopy procedure codes 39401 and 39402. Last code here, guys, are the diaphragm procedures 39501 and 39561. Here you have a couple of different procedures for the diaphragm. You actually have some repair codes, such as when the patient has a hernia, and then you have 2 codes for resection. All right, guys, this has been the rest of the 30,000 section. There was a previous video that focused on the respiratory system, and here we are focusing on cardiovascular to the end. Next video focuses on the 40,000 series. Thank you guys so much for listening, and have a great day.